I'll begin by asking unanimous consent to insert into the record documents show that the CIA transferred funds to NIAID through interagency agreement. Hearing no objection, so ordered. We had hoped to hear testimony from Anthony Fauci today. We haven't, but I think it's important that we do hear from him. So we will have a video we'll play in a moment. For years, Anthony Fauci has been the public face of saying this in all likelihood came from nature. He kept saying, it's the marketplace, it's the marketplace, it's the marketplace. He's been saying that on television up until recently. But what we find is that what he was saying in public is different than what he was saying in private. In January, in private, he wrote that looks like the wet market was a super spreader event. It didn't originate there. We know that some of the earliest deaths and sickness came from somewhere else. But then for years and years, we got dishonesty. So let's play the video so we can see a little juxtaposition of the problem we're dealing with.
Fauci's journal entries contradict what he said publicly about the origins of COVID-19. Fauci admitted in January 2020 that the initial outbreak of COVID did not occur at a wet market.
Take a really good look at the animal-human interface and the fact that animals from the wild are being brought into wet markets.
You have animals that come out of the wild that are sold at these open, what they call them, wet markets. Wet markets, where you bring animals in from the wild who have these viruses. The wet markets in Asia, where people bring animals from the forest into market. There are wet markets in Wuhan that are ample opportunity for a virus to jump from an animal. The origin was from a bat to an intermediate host to a human, very likely in a wet market.
And those animals should not have been in the Wuhan market. They knew that those animals should not have been in the market, and they immediately cleaned out the market, put restrictions on the kinds of animals that come into these wet markets. I think they should shut down those things right away. I mean, it boggles my mind.
So repeatedly saying in public something different than what he believed in private. Now this is interesting because, you know, the first SARS outbreak in 2003 was traced to a wet market, to animals there. But interestingly, they had evidence. They had evidence that the animals had the disease. They also had evidence that the handlers had a disproportionately high number of antibodies to the disease. So there was evidence, and the evidence was presented. So when this came out, the same thing happened again. They did look at the wet market. They looked at the wet market and tested, I think, 80,000 animals and didn't find any animals that had COVID-19. When they did find COVID-19 and trace samples there, they found that the DNA or the RNA was consistent with human spread. This was known not later on, didn't take years to develop, was known in January of 2020. And so Dr. Fauci says privately he knows it didn't come from the wet market, but as you saw, those were over a multi-year period. One of the other discussions I've had with Dr. Fauci over the years about natural immunity. So most infections, you get a degree of immunity, not perfect, some fairly perfect. Smallpox, you just don't get again. George Washington knew this. He had his wife get vaccinated, but he didn't because he'd already had smallpox. But there's one particular story that a man came up to me who'd lost his wife to COVID. He said, we all got it. We all got sick, and my wife ended up getting sick enough to go to the hospital. But we'd recovered 2 weeks. She was still alive. 2 to 3 weeks later, we'd all recovered, and they wouldn't let us be with her. And to this day, it's one of the saddest things. And it just, I think all of us should think about this. They were not allowed to visit their mom. He wasn't allowed to visit his wife in the hospital. But based on this misunderstanding of natural immunity, that for some reason 2 weeks later they were a problem. But this was all promulgated by you. We had the workers in the meat factories. They were essential. They had to keep working. Most of them got COVID. They got it in the first couple of weeks. Most of them were younger. The reassurance should have come from public health. The reassurance should have said, congratulations, you've recovered. It also should be acknowledged. What's the number one thing we can do if we get another pandemic? Before we have a vaccine, before we have monoclonal antibodies, it would be to utilize natural immunity. So instead of the advice you were giving to Cuomo and others in New York that led to the deaths of hundreds of thousands of people or tens of thousands of people, you could have been saying, well, maybe the nurses taking care of the elderly should be people who are 2 weeks out from COVID infection. We could have used natural immunity as somewhat of a block or protection. Imperfect, but the only protection we had and the only thing we could have done. Instead, the nursing homes were seated with people who had COVID. So I think the discussion of natural immunity is one where there wasn't sufficient honesty, humility, there wasn't enough presentation to encourage people. That was the only encouraging thing we had for a while is you've got it, you're very, very, if not impossible, close to impossible chance that you'll die if you get it again. Everybody could have been reassured. Nobody was reassured. It's like, well, we don't know. We just don't quite understand natural immunity. My favorite quote from that is from Martin Kulldorff from Harvard. You called him one of the people that you had to take down, the fringe epidemiologist, which I've never ever heard a scientist call another scientist that. But he jokingly said on Twitter, he said, yeah, we knew about natural immunity from 486 BC, from the time of the Athenian plague. We lost all knowledge of it in 2020. The good news is it's slowly coming back. 24 to 2025, we're beginning to understand what natural immunity is again. Not something perfect, but a useful tool that could have been used, but also something that could have helped people by telling the public, my goodness, you're not going to die now. You have a chance. If you've already had it and you're 85 years old and you're at risk for it and you're wanting to feed your wife and they're telling you to wear 4 masks and not be around your wife when you've already had it, it made no sense. I visited with a man whose mom was 83 and she was dying from COVID. They go to the hospital in Orange County. They won't admit her to the hospital till she's vaccinated because we have a policy that everybody in the hospital must be vaccinated. She's got COVID and they wanted to vaccinate her again. At one point in time, the CDC understood this. They told people, don't get vaccinated if you've had COVID within 3 months. Why? Because it may give you a heightened immune response when you've already got a heightened immune response. But giving a person very sick, and many of the people who died from COVID died from sort of this storm of response, this immune storm. The answer wouldn't be try to stir up their immune response more by giving them a vaccine. The answer was actually steroids. And good old-fashioned steroids, 37% reduction in death. It turned out to be way more valuable than remdesivir, way more valuable than any of the other treatments. But I don't remember ever hearing a complimentary word on natural immunity or steroids or anything else. And you know, I wish we could have done more today. I would have been willing to accept an apology today. I'm sorry I made mistakes. We all made mistakes. And, you know, at the time, I thought the gain of function research was, you know, the risks of it were worth the benefits. But I've reassessed since 15 million people died. People say, well, gosh, these things never happen. We know it happened in 1977. We know with 100% certainty a virus escaped. In 1977, there's something called the Russian flu. Nobody's exactly positive how it got out. But when they sequenced it, they found out that a flu in 1977 had exactly the same RNA as a 1954 one that they had in the lab and they had created a vaccine for. In fact, turns out anybody born before 1954 was immune, and the only people who got it were people who were born between 1954 and 1977. But it was identical. The genetic sequence was identical to this vaccine or the virus from 1954, and that doesn't happen because these respiratory viruses are always mutating. To be identical means it had to have leaked from the lab, proof positive that it had. So we know this happens. An author by the name of Young wrote a book and said there was 1,200 cases of significant accidents that have occurred. We knew all of this, and yet it was completely discounted because I think you were worried that if it was seen that you funded dangerous research that started the pandemic, you'd get blamed. And it was a concerted effort. It wasn't just you. Anybody associated with the funding decided we needed to protect ourselves.